Welcome to Nurses' Voices. This season, we are focusing on nurse-led solutions to the current nurse human resource crisis in Canada. Our guest for this episode led the development of the Sharing Circle, a website that provides a directory of resources, education, training, and support related to Indigenous wound, ostomy, and continence health. Welcome, Bev. Bev Smith is a nurse with Alberta Health Services in Edmonton, and she is a volunteer with NSWAC Canada and leads the Indigenous Wound, Ostomy, and Continence Health Core program. So could you tell us why or how this project, the Sharing Circle, came to be?
Yeah, of course. Thank you, Mary. First, before I start, I just want to acknowledge I'm hosting this podcast within Treaty 6 territory and within Métis Nation of Alberta Region 4. I acknowledge this land as the traditional territories of many First Nations peoples such as Cree, Dene, Stoney, Saulteaux, and Blackfoot. I make this acknowledgement as an act of reconciliation and gratitude to those whose territory in which we reside. So first, I want to just talk a little bit about the background and how we came about. NSWAC Canada have formed an Indigenous Health Core program in order to be part of the Truth and Reconciliation from more of a healthcare standpoint. The core program was launched in June of 2018, and I became the leader in October of 2018. We brought together Indigenous nurses caring for Indigenous people, in order to just identify the changes that needed to occur and to be able to strategize collectively and come up with more solutions for all the different problems that the nurses were actually expressing in order to get more resources to Indigenous people. For example, in the very beginning, in 2018, NSWACs across Canada were not prescribers to the NIHB, which is the healthcare coverage for Indigenous people, for wound ostomy continence products. We were not able. It was doctors and nurse practitioners that were the only ones able to do this. So our group advocated to NIHB to become prescribers in order to improve the timely access to supplies, because a lot of times there's no doctors and nurse practitioners in these remote communities. So they were waiting in order to get these orders done. Our little group advocated to NHB, and they actually did make a change. And now NSWACs can recommend wound ostomy continence products, supplies through that NHB program. So it's a significantly huge step in order to get products and timely supplies to patients. We were looking at the cultural safety piece of it as well. We wanted to make sure that within NSWAC Canada, there was cultural safety components in the educational programs and also to the national standards of practice. The core program has also held 3 webinars on how to improve healthcare for Indigenous people. And we also presented twice at our national conference on better equity on Indigenous healthcare. So that's how we were trying to get our cultural safety piece in there. In order for the recruitment and retention, we're always actively recruiting Indigenous nurses to take our post-grad NSWAC program and the Skin and Wellness Associate Nurse program. Once they do take the program, we have much support by providing mentorship, and also we invite them to participate in the core program. Then also with the generosity and support of our industry partners, we've established 2 full scholarships, which is great because they're for Indigenous nurses to take these programs. Now with the Sharing Circle, this is a new initiative that our Indigenous core program developed, and we thought, how can we address the need for more sharing, more getting information out there? Like I said, a lot of the nurses, they don't know, like they're looking for resources, they're looking for some sort of education. So how can we get it out there across all of Canada? So what we did is we thought, what about a website that has online information? It's all centralized for different educational resources. And the aim of the website just was to enhance the accessibility and information of all the resources and to improve healthcare for the Indigenous people. In order to do that, we took resources that we knew of. We also put it out there for visitors, we call them, to the website. If someone comes on the website and sees that, maybe something's missing, maybe they need something else on there, we totally welcome that as well. We also have a section on the website that has find an NSWAC. So if you're not sure and you need an NSWAC in your area and you don't know where to look for patient, they can search or find an NSWAC, and one would pop up, and you can just put in your question or comment, and it would come through to the closest NSWAC to your area. It's hard for us to get nurses even to come into our program, but Indigenous nurses specifically. We want to recruit more. We want to be able to support them more. I think with our program, the core program that we have, in order for it to grow and get those nurses involved, it's great. We work with many people across Canada right now on my core program. When we first started, it was pretty small. It was just a handful of people, mainly NSWACs, a couple of patients, but it's grown now to over 40 people. There's 40 of us on. We meet once a month via the web. We just do Zoom meetings, and we discuss, what do we need to do next? What's our next goal? What are we going to work on? There's different things that come up, but definitely this website was one of our main focuses and we're very proud of it. We have researchers, we have allied health with us, we have a very diverse group. We put our heads together and we kind of come up with different topics and ideas, and what is needed right now. What are the Indigenous people saying? And we strive to get good communication and build those relationships with the Indigenous communities so that they will be comfortable and tell us, what do they need? What do they want? What can we help them with? And I think this website is definitely something that's going to benefit not only healthcare providers, but patients as well.
Thank you, Bev. That was fantastic. I have a couple of comments, questions, just for clarification. You talked about NSWACs, and by that you mean nurses specialized in wound ostomy and continence care. And then there is the national organization of NSWACs, which is called Nurses Specializing in Wound Ostomy and Continence Care Canada.
Bev, what I would find interesting is this initiative. How is it helping with the current health human resource crisis for nursing in Canada?
So as we know, nurse staffing shortages are terrible across the country. And that is also in Indigenous communities, in Northern communities as well. I feel like our initiative with the Sharing Circle website, there's three things that I could think of right off the top of my head. The first one would be support. Nurses that are frustrated, not knowing where to turn. Nurses in the North, they're not specialized. They're not, most of them don't have that ability to have that specialty. So in order to get onto the website, get mentorship from an NSWAC, ask an NSWAC, and all the resources that we're trying to develop and put on the website. So that's one way. Another way, the scholarships that we were able to retain. Those scholarships are full scholarships. One is for a registered nurse to the NSWAC program, and the other one is for an LPN or registered practical nurse in Ontario for a full scholarship to the SWAN program. So if a nurse, for example, is frustrated and ready to leave the profession and, or, just thinking, I need a change, and they have any, I guess, love or passion for ostomies, wounds, or incontinence, then they could apply for this funding and get a full scholarship and, pursue that. In order to be an NSWAC, it's something that you really need to be passionate about. It's a job that I truly love, and I love engaging with those clients and getting those professional relationships, but it's very rewarding. So I would say that that's one way that we can recruit and retain nurses, Indigenous nurses for sure. And then the third one I want to say was that the website does allow for clients and family both to go on to the website. They're able to go on and find their own resources and look up things that they might need for their own healthcare. That would free up some time from the overwhelmed nurses in the North, in any community, really. It gives them that autonomy to make choices and look and find things on their own.
What would you like our viewers, listeners, to take away from tonight?
I think having the viewers know that we have a core program for Indigenous wound ostomy continence. We are here and we're so open to anyone that wants to join. It doesn't need to be an NSWAC or an RN or LPN, whatever. It could be a patient, it could be a family member, anyone that feels, passionate about getting better healthcare, more equitable healthcare for Indigenous people. That is our overall goal. That's why we were formed. We want to make sure that we can, help anyone that has a wound ostomy or continence problem in Indigenous communities. That's kind of our overall goal.
Do you have some advice for nurses who are maybe waiting in the wings, or someone's looking at them saying, would you take the lead on this initiative?
I think for any nurse that wants to get more involved with something that they're passionate about, jump in 2 feet, because you're only going to know what you know until you get in there and do it.
This is a great example of nurses who really are volunteers saying, here's a problem. We have something that will help. We're going to make it available to anybody and everybody who has an interest or a question or a concern or whatever. And that's good for you. That's all I can say. And I wish you the very best.
You can watch any episode of Nurses Voices from our first 2 seasons on a variety of platforms, including YouTube and Apple Podcasts. Subscribe to our channels to ensure you don't miss any of our new episodes, or go to our website, nursesvoices.ca, to sign up for our free newsletter. Nurses Voices is generously sponsored by Pfizer Canada. It is created by Donner Wheeler and produced by Sector Limited. It is supported by the Canadian Nurses Foundation and the Canadian Nurses Association.